Everybody, I'm Dr. Tom Pastor. I'm joined today by Dr. Cassie Wilder and Katherine Huber, and we're going to talk about poop because we think that it's not talked about enough. So, so I'm going to go ahead and pass it to them to introduce themselves and let you know a little bit about what they do.
Hi, I'm Dr. Cassie Wilder. So I'm the owner and founder of Minneapolis Integrative Medicine Center here in Northeast Minneapolis. And one of our subspecialties that we see here is digestive dysfunction. So we see a lot of patients with, poor pooping habits, constipation, diarrhea, bloating. A lot of our patients have been down the conventional rabbit hole and kind of been told that there's really nothing wrong with them. And I think we'll prove to you today that there's a little bit different of an approach and different way of looking at things that makes us successful. So.
All right, and my name is Katherine Huber, and I am a registered dietitian nutritionist, and I work with Dr. Cassie here at Minneapolis Integrative Medicine Center. And as a dietitian nutritionist, I really get to dive deep and look at how what we eat and our activity and lifestyle all influence our digestion. So it's not always just about what we eat, but a lot of it has to do with how we eat, where we eat, when we eat, and movement. And we're going to explore all of that today.
Nice. And I'm Dr. Tom Pastor. I'm a doctor of chiropractic, and I really specialize in helping people get to the bottom of complex health conditions, usually centered around really chronic, long-standing pain that isn't just as simple as a chronic, long-standing pain, whether it's related to digestion or other components like mental health or old injuries and things like that. And that's what really brings us together today, is talking about how a lot of these things can interplay. And I am actually going to pass it to Cassie to get us started.
Yeah, so I think the first thing we wanted to start with is just talk about what is normal. Like, what is even normal when it comes to poop and your digestive tract? So one big piece is going to be that your large intestine or your colon is what we consider your gut when we're talking about that in those terms. Your gut is lined by a ton of normal, good bacteria that's supposed to be there. So species such as lactobacillus, bifidobacterium, Bacteroides. If you turned over the back of a supplemental probiotic, you will probably find all of these bacteria that are listed on the back of a supplement. So those are typically the good normal flora that's supposed to be there. So a lot of those bacteria actually they have secondary functions, not to just hang out with you all day. Their other function is going to be for creation of things like neurotransmitters or your brain chemicals. They can create their own sources of neurochemicals such as GABA, which is kind of our body's natural Xanax and calms us down. And then also serotonin, which is considered to be a happiness hormone and helps positive mood and positive affect. And so these little bugs that you're kind of carrying around with you 24/7 can actually help you out and create sources of your neurotransmitters or your brain chemicals. They also host about 70 to 80% of your immune system down there in your gut. So when you're getting sick or when you're exposed to things, you have little kids, and little kids are little germ factories and they're bringing stuff home. It's really kind of the initial forces of your immune system come from your large intestine, from your gut. And it's the central place for those immune system cells to mature and actually be, mature enough and old enough to mount an attack against whatever has invaded you, such as the cold or flu. So your gut also connected to your brain via the vagus nerve, which I think, Tom, you could talk more about later because that's really probably your area of specialty. But your brain and your gut talk to each other. So feelings of peace and happiness and calm are all signs that your brain and your gut are in good communication with each other. So I kind of really want to talk about what a good poop looks like. So
that was actually what I wanted to kind of
Is that what you wanted? Oh, sorry, man.
I would love to say that I knew what normal was, because I think all of us really like to know that we're normal, but
yeah.
What would you consider as somebody who actually talks about people's gut health from the sake of, actually talking about poop regularly? Like what is normal rhythm? What would you consider healthy poop?
Yeah. So kind of like a top-notch poop would be at least once a day. Once a day is kind of a minimum for us. So normal transit time from your mouth coming out the other end is about 18 hours. So that's about once a day that you should be having a bowel movement. It should be easy to pass. So there should be no need to force, strain, put a lot of extra effort behind it. It should easily come out. And then it should also be a kind of soft brown, neutral brown color. And then it should come out in relatively one longer piece. I think that it's a common misconception that it only has to come out in one solid, 12-inch log, but that's not necessarily true. You do have curves of your intestine, and though it can break up as it goes around the curves, but you just coming out in solid pieces versus marbles or soft serve ice cream. It should just come out in a solid log, really.
Yeah.
You should not notice any undigested foods or mucus. If you're having any blood, that's obviously a rise for concern. But yeah, easy to pass, normal color, no real effort to get it out. So if you're sitting there for 30 minutes waiting for it to all come out and pass because you don't feel fully evacuated, also not normal.
So what are some of the most common things that really tell you something specific? So obviously we know blood in the stool, not a good thing. That's usually, but like, what are some of the more common but less typically alarming things that you could say are easy to kind of move one way or the other?
Yeah, so we typically go through a few different characteristics of your stool. So do they sink or float? It's kind of one of the big things. So if your stool is floating kind of close to the top, that could mean that you might not be absorbing the fat that you're eating through your diet. And so then it'll come out in your feces, and fat will actually make your stool float. So that's one of the things. If they're coming out looking like marbles, generally means you're not getting enough water. It's like little rabbit poops or little deer poops. They should not be coming out like that. So looking at your hydration status is really big when it comes to, how they're coming out. And then also soft serve ice cream. I'm sorry to bring like America's favorite food into what your bowel health looks like, but soft serve ice cream is really soft, and it could really mean that you're not getting enough fiber in your diet, and that things are just transiting too fast for it to actually firm up and get through. So the next is going to be the smell. Feces just smells like feces. It shouldn't smell like a toxic waste factory. It shouldn't smell like rotten eggs. It shouldn't smell like a lot of other different weird things. It should just smell like feces. And so if it does smell pretty noxious, that could be a sign that you're potentially, detoxing or eliminating any sort of environmental toxins, or that you're taking or eating something that is not necessarily good for you. So the next one is going to be the color of it. So I kind of hit on that earlier, light versus dark. So really dark stool could mean that your feces is mixing with something like blood that's higher up in the system. So if it kind of comes out looking like coffee grounds or really dark, that's not necessarily a good thing. And then also, do you want to finish this one?
All right. And then also the color too, if it's too light, that could also sometimes be indicating a fat malabsorption as well. And that might also accompany if the stool is floating as well. And then Cassie also mentioned earlier, so undigested foods that you're noticing. Naturally, there are some foods, such as ones that are really high in insoluble fiber that you might see looking exactly the same as it came in on the other side, but other foods that your body should normally be breaking down, you should be seeing in your stool.
Yeah. Could be a bigger issue such as like low stomach acid, low pancreatic juices, some sort of like low digestive juices causing them not to be broken down. And so you see fibers on the other end.
Yeah.
Yeah.
Interesting. Cool. Well, that was really, so when they see kind of variations, there were a couple of them that were pretty easy to really diagnose. I mean, if it's coming out small rabbit pellets, then drink some water. That seemed pretty simple. But what do you do when somebody's not digesting their fat? I mean, that sounds like, from what you were talking about gut bacteria, that sounds like something that probably has to do with either your gut lining not doing its job or the gut bacteria not being present to do their job. What would you do
So
for
that's
something like
one
that?
of those really interesting things that it actually has to be emulsified in order. So emulsified just means making it water soluble in order to get into the body and be used. And so your gallbladder is actually responsible for doing that. And so a lot of people, if they have just low bile output, so their gallbladder is just really slow and sluggish and not outputting enough digestive juices in order to do its job, that can cause fat to be in your stool, which is probably the most common cause. Malabsorption, so even if your gallbladder is doing what it's supposed to do, but your small intestine just isn't able to absorb some of that, then that could be an issue. So looking at like small intestinal bacterial overgrowth or celiac disease could be an issue where you might not just be absorbing your fat very well. But typically the low-hanging fruit on the floating stools is going to be gallbladder dysfunction. 9 times out of 10, that's going to be our culprit. Yeah.
So what's other things that you guys typically advise beyond supplementation or medication? What are things that you usually talk about for influencing just the movement of your bowels?
So this is where food comes in. So in our practice, we really emphasize food as medicine, and we really see that in so many different conditions that we work with, and digestive concerns is one where we really see a big impact with how what we eat influences our digestive processes. So the first thing that we really explore in terms, if we're talking about poop and in terms of what that's going to look like and how our digestive is functioning in terms of, is it going too fast? Is it going too slow? So diarrhea or constipation is really looking at fiber. So the function that fiber is going to have on our bowel movements. So there's 2 different forms of fiber. We have soluble fiber and insoluble fiber. And both of those are really important when we're talking about having that optimal bowel movement because they both have different functions. So insoluble fiber, I like to think of as a scrub brush. So it's something that is going to provide some bulk to our stool, and that's going to help kind of clean out our colon and our digestive tract as the food is moving through it. And so typically with insoluble fiber, we actually see an increase in transit time. So food might go through our system and our stool might go through a little bit faster. So if you're struggling with looser bowel movements or even diarrhea, a lot of insoluble fiber is not going to be very well tolerated on your system. Yeah. So that's often why, I think a very common recommendation for diarrhea is the brat diet, because these are often foods. So that's like bananas, rice, it's applesauce, and toast. And so these are foods that are typically lower in insoluble fiber and easy for the body to break down and to tolerate. So sometimes they'll talk about limiting fiber in general. My philosophy is I don't think you need to limit all fiber because fiber still is really important. And when we talk about the 2 different forms, the other form of fiber is soluble fiber. And soluble fiber is kind of what provides, as the name implies, it is soluble in water. And so soluble fiber helps to absorb water and bring that into the stool. And so again, that can provide bulk, but it also helps to slow the passage of the feces and the stool through our bowels, through our digestive tract. So that can help to slow down the transit, which can often be helpful for diarrhea. And it can also be really helpful from another benefit when Cassie was talking about gut bacteria too, because there are specific forms of soluble fiber that are also fermentable. So fermentable fibers mean that fiber in general, as we know, is something that typically our body can't break down. Our body doesn't have the digestive enzymes to break fibers down and access the nutrients to be absorbed into our bloodstream. However, the bacteria within our digestive tract do have enzymes that can break down specific soluble fibers. And so we call those fermentable fibers because what the bacteria are doing is that they are fermenting these fibers to access the nutrients that are then giving them food sources to live and to propagate. So that's one of the ways that soluble fiber is really important, is it also supports the diversity of all the different bacterial strains that we want living in our digestive tract.
Yeah. So how, obviously a variety of gut bacteria is important, and sort of taking every probiotic under the sun. Like, what do you do to help promote that? Because it's my understanding that a lot of the issue we're having with gut bacteria now actually stems from the fact that we're just not being inoculated with bacteria in general. Like, we live in a very sterile environment, and a lot of our efforts to be sterile and keep bad bacteria out and essentially keep ourselves from getting sick is also keeping us from being exposed to the positive bacteria and things. So what do you do other than feeding them, which it sounds like soluble fiber is really the trick to helping them grow, but what if they're just not there? Or is that something that you test for specifically? Like, is that one of those things you just come see your naturopath?
Do you want to start with the testing part?
Well, we can test for it. So one of the big things that I think both of us see a lot in clinical practice is that you only have so much space on the lining of your intestine for these bacteria. So Katherine had this really great analogy that there's kind of like just a limited amount of hotel rooms that are sitting in your colon and able for bacteria to populate. And so if you have all the rooms filled with good bacteria, that's fantastic. But majority of the time, people that are experiencing some sort of intestinal discomfort or gut dysfunction have some of those rooms taken up by bad bacteria that are not supposed to be there. And taking oral probiotics, they're not assassins. I mean, lactobacillus is not like going in there and just killing off everything that it comes in contact with. It's pretty benign bacteria. So if you have no hotel rooms left to even be inoculated with new bacteria that you're being exposed to, it doesn't really matter. A lot of this pathogenic bacteria and yeast actually have to be killed first in order to free up some of those rooms and then allow for good bacteria to populate later. So that's where testing can really help us. If you just donate a stool sample to science, we can test that right on up. We can culture what's going on down there. We can find out the exact species, how much is living there, and then we can kind of figure out the good, bad, and ugly of what's living in your bacteria and in your colon. I'm sorry. So outside of just like licking dirt, I'm not quite sure there's better ways to get inoculated besides eating really good fermented foods, taking good quality probiotics, but then also rotating them. So you don't want to just stick with the same brand every single time over and over again. You want to rotate through them to get other strains, other species, and then other quantities of those. And so, yeah, I think testing is probably one of my favorite ways, especially if there's something going on, like there's an actual problem that needs to be fixed. Right. Taking a probiotic's not generally going to fix those problems because they're not assassins. They're not going to kill what's ever bad down there. Right. So.
Yeah, and testing is really, I think, one of the first steps that we do, but we also get the question too of so just because let's say the dysbiosis isn't really an issue, should I still take a probiotic? How might that influence things? And just because they're not residing within the digestive tract, they're not able to reserve a hotel room, so to speak, doesn't mean that they're not still having benefit. So there is a lot of benefit that can happen just from having the introduction of probiotic-rich foods and probiotic supplements to the intestinal lining, where they might reside there temporarily, but not be able to actually lease. So you can think of it as maybe the probiotic could rent a hotel room for 2 or 3 days versus being able to lease that as an apartment where it's going to be there permanently.
I'm really loving this analogy, actually.
Yes, we're turning our hotel now into a condo. Yes, but because the probiotics can still be there as a transient bacterial strain or microbial strain, it can still have benefit where it still might support the synthesis of neurotransmitters, even though it might not be there long term.
Yeah.
That's where it's
cool.
Yeah.
So actually, talking to neurotransmitters, it's a really cool kind of transition. So we had talked before about how gut bacteria produce a lot of serotonin, which a lot of people don't realize. Is that one of our neurotransmitters, being serotonin, is responsible for not only good mood, but also emotional processing, is made in the gut. And it's also, you taught me this actually, Cassie, that serotonin is also associated with gut motility, which is also associated with how you move food through your bowels. And I don't remember if you guys are familiar with this, but that's actually a component of Chinese medicine is they associate emotional processing with digestion of food. So like they'll tell you put something like one of the practices is if you want to digest an emotion, move the energy to your stomach. So
Yeah.
So that really leads naturally to the gut affects all areas of health, all areas of our system. So right now the gut-brain connection is very popular to talk about. It's very easy to discuss the vagus nerve and how neurotransmitters flow one way and how the vagus nerve supplies a lot of signal. But what are some of the less known links that you guys have found? I mean, I know that skin is a really solid indicator of what's going on in the gut. But what are some other ones that you guys can that people can tie with the poop knowledge that they now have to kind of help themselves come to a conclusion?
One big thing that I have seen a lot of is going to be like anxiety, but also headaches and migraines. So these bacteria that live down there, correct? Katherine had talked about how they're eating the fiber that you're eating, and during this process, they're fermenting this fiber. But a byproduct of fermentation is gas and metabolites, which is farting, and for lack of better terms, flatulence. So the gas that gets created by these bacteria fermenting what you're eating can be either good or bad. So, and depending on where it is in your digestive tract, it can actually get through, or also how compromised your gastrointestinal tract is. So things like leaky gut, intestinal permeability, SIBO, all these different things that can cause that lining of your intestinal to be a little bit too leaky and too permeable. These gases can actually escape the tract, the GI tract, and cause other things throughout your body. So that's kind of where skin comes in with like eczema, psoriasis, acne, can get to cross the blood-brain barrier and cause things like anxiety. But then also when it crosses that blood-brain barrier can cause things like headaches and migraines. And so then looking at the metabolites and the fermentation, the gases that the bacteria can create, they can create almost anything to go wrong throughout your whole body. So,
right. I actually didn't know about the migraines one. I knew about headaches and anxiety, but it didn't occur to me because migraines are something that a lot of chiropractors struggle with when helping people because they're essentially vascular headaches. So sometimes just reducing pain, reducing anxiety levels helps, and getting people moving a little easier helps. But other times, migraines just really, they hold on there because there's such different presentations for different people. Yeah. So it's very interesting.
Yeah, inflammatory, hormonal, there's so many different pieces to a migraine that you got to look at that are not just like structural and vascular. So, yeah.
Wow.
We see a lot of also this like in kind of that IBS diagnosis that we had chatted about briefly of IBS, is just kind of like an umbrella diagnosis that a lot of gastroenterologists or, Dr. Google would like to give you for your symptoms. But really what we see under this umbrella of irritable bowel syndrome is going to be what's the root cause of why this is happening. So IBS just generally means there's something wrong with you, but we don't quite know what that is. We just know that like you're having diarrhea or you're having constipation or you get these occasional like spasms. So we don't really know what's going on, but you got something. We don't think you're lying. So when I see that, I say, okay, cool. We know something's going on with your digestion, but what are some areas underneath this umbrella where we can start investigating? And some of those pieces of the umbrella are going to be looking at how bacteria ferment the foods that you're creating and create those gases. So one big area that I like to look at is called small intestinal bacterial overgrowth. So your small intestine and SIBO, that's
what to connect those two acronyms. Yeah.
Yep, SIBO and small intestinal bacterial overgrowth are the same thing. Your small intestine is actually the organ that comes right before your large intestine in your digestive tract. And it doesn't really have a place for those gases to escape as easily as the lower intestine does, right? So those gases have to get out of the small intestine into the large and then out the anus, or it has to come like back up the stomach and then get belched out. Like it just takes a little bit more time and effort for the gases to escape. So a lot of patients will notice that those gases get trapped And they cause a ton of bloating and a ton of discomfort. And so you're just, whatever you eat that's easily fermentable, so things that are high in fiber, generally, if you've heard, or if you know the audience has heard the term like high FODMAP foods, so the fermentable or the fructo oligo
Dimono.
Yeah, I'm like
something. Yeah.
don't quote me on that one. The high FODMAP foods are just very easily fermentable and able to create gases from them, and so you'll get things like abdominal pain and distension, things like reflux. I've seen this contribute a lot to anxiety and a lot of migraines, but then also a lot of skin manifestations as acne, psoriasis, dry patches. So the small intestine is one place that we look for IBS root causes. Another one's going to be food allergens. So if you do have, squeaky clean digestive tract, no bad gut bacteria, and they're just all great bacteria, what you eat and how it affects the intestinal lining can be really important. So like we said, your intestines hold about 70 to 80% of your immune system function. So if you're eating something such as gluten is kind of a hot one. When you eat gluten, if that protein in gluten actually affects the lining of your intestinal cells, it can cause a lot of inflammation locally to the tissue and then make it a little bit more permeable. So the cells are supposed to be, tight. They're not supposed to have any gaps between them. And so if it becomes a little bit more permeable, your immune system starts to notice things that are going on inside of your gut that it doesn't necessarily need to notice or noticed in the past. So you can create food allergens, which are just immune system activations to foods that you're eating. And these food allergens can cause lots of different things. And then the other one kind of under that same umbrella is going to be things like candida or yeast overgrowth. I know that candida has a lot of, like, if you Google it, you can see like, oh my gosh, I have systemic candida, or, it's living everywhere in my body. I don't necessarily think that that's true, because candida that just readily floats around in your blood should and would put you in the hospital. So I generally look for candida in places like your small intestine or your large intestine or your vagina, or places where it can kind of populate in a warm, nourishing environment and live. And so I don't normally see, systemic candida. I don't really believe that's true, but we can test for it. If you just want to donate some of your poop to the lab, they'll figure it out for you. Mm-hmm. Don't send it to me.
So I guess a little kind of pulling away from the bacteria, we mentioned a little bit around movement and things too. So as a chiropractor, I face some of the more mechanical side of this. So a lot of people don't really associate back pain with their digestive problems. They don't associate but that's because really with a lot of these symptoms, what makes them so mysterious is that the gut doesn't really have a very specific sensation of what's going on inside it. So you get what we call referred pain. So sometimes people will come in, like you were talking about gallbladder too. It was very interesting creating a picture of that, because it can be until you have a gallbladder attack where your actual side hurts. It's not the side where your gallbladder is, it's on the other side. Until your actual gallbladder hurts, a lot of people don't make that association. So it was very interesting to me that, floating stool combined with, in the case that I would see is referral pain to the right scapula, the right shoulder blade. People don't kind of draw those associations and don't really think about, there are mechanical things that you can do to kind of help your poop along. You had mentioned movement, so I'm really fascinated to know what you guys talk about when you talk about movement.
I would love to hear your recommendations.
Oh, yeah.
Outside of my beloved squatty potty, I don't really know.
Well, but that's actually very relevant. Like the squatty potty, a lot of people make a joke about it, but human beings are meant to squat to poop. So there are parts of the actual musculature involved in the process. Like the sphincter does not relax in even a normal seated position. A lot of people get this sensation not being fully evacuated because they aren't, because the actual sphincter can't relax enough to let it all out. And that's one of those things where being in a squat position, which most Americans can't get into after the age of 30 anymore, actually really helps with the flow of it. So if somebody's feeling constipated, that's one of the first things I'll advise as well. Try getting into a deeper position. And of course, that's fun and awkward to talk about. But the other thing they can do is that I actually find myself doing is visceral manipulation for people. Because most people,
like organ.
Yeah. Mm-hmm.
Yeah.
So people don't usually know that, well, any therapist really can manipulate organs, but particularly chiropractors and massage therapists can reach in and move. I mean, we can help if someone's constipated, we can help move things along. And it's a simple thing to actually teach someone. I've taught people that to help their kids who are feeling constipated. I've helped them, you can do self-abdominal massage, but also in things when you're looking beyond just simple constipation, you're looking at other digestive issues. I mean, you can work with the liver as it's trying to detox things, which people don't realize. You can work to kind of massage the liver and the gallbladder both to kind of increase bile production to help with fat digestion. You can also do it to help clear medications out of the body or other toxins. People have had us do it for hangovers before. It hurts because your liver's inflamed when you have a hangover, but it works. So that's really, like, those are my main, when someone's feeling constipated. There's also a friend of mine found poop yoga. So it's yoga that gets you in so one of the primary philosophies of yoga is that you usually start on the right side and go to the left because that's the direction that your gut flows. Yes, start with the right, go to the left. That's the way your gut flows. And so there are certain twisting movements. So like, I don't have the routine off the top of my head. That's something I'll post in the notes. But there are certain positions that you can, certain stretches, certain just typical yoga poses that will stimulate your gut in the right way to help you release.
Yeah.
But beyond that, I mean, that's the real trick of it is it's actually pretty simple. It's just being able to recognize that you can do things like manipulate viscera, and it doesn't just have to sit there and be bloated and uncomfortable. I mean, it's uncomfortable to have somebody's hands in your guts, but so what do you guys?
Good after.
What was that?
That it doesn't feel good, but it feels good after.
No, it feels excellent afterwards. Yep.
Yeah. The kids off at the pool. It just.
So what do you guys usually recommend movement-wise, other than what I just talked about? So yoga we knew about, but other than things like visceral manipulation, is there any other components that you guys typically recommend to help people who are either feeling constipated, which is what I was talking mostly about, or going the other direction where things are just flowing a little too fast?
I mean, I think just general light, gentle physical activity on a regular basis is really helpful in terms of promoting a regular, consistent bowel movement pattern too. So I think of, like, if you've ever been on a really long flight and then you notice that your digestive system's off, maybe you feel more constipated after you travel. I mean, there's a lot of different reasons for that. Dehydration being one of them too, but also just the lack of movement can definitely impact the way that our digestive system functions. So we do see with lack of movement that our digestive system definitely slows down. And so that can also impact constipation. And so just establishing a consistent physical activity routine can be helpful in addition to the yoga.
So speaking of, is this one of those things where having yourself on a consistent routine, like sleep routine and things like that, is that one of those things that you recommend? Or is it one of those
movement routine?
What?
Like a movement routine?
Yeah. No, I'm in a poop routine. Well, it is a
poop routine.
You can't train yourself to poop in the morning.
I think you can too. I just don't. I think that people like assume that just because you poop at the same time every single day that's like the norm, but most people don't. I would say that the majority of patients that we have don't poop at the same time every day or like notice that pattern, but and potentially they're noticing if they do that they poop at the same time every day, they notice a pattern. It's like 30 minutes after coffee. It's like, that doesn't count.
Very true. I get that a lot.
I do.
Yeah. I poop every time in the morning. Oh, when? About 30 minutes after I drink my first cup of coffee.
Yeah.
Okay.
It doesn't count.
Why doesn't that count?
Because coffee is a stimulant. It will for sure increase the amount and speed that your bowels move through. And so, pretty common known fact though.
Yeah.
But I guess going back to movement, or I guess part of this too is there is evidence that you do want to respond to the urges that you're in, the signals that your body's sending you. So sometimes when we're working, we get in the habit of, okay, I gotta go to the bathroom, I'm gonna push it off, and we keep pushing it off until we finally have a break. But not responding to those signals appropriately can definitely influence difficulties that we'll have in terms of digestion function too.
They notice that in children a lot. I think that's just where they probably study it the most, but they'll notice children, like during the school day, if they're, asked to go to the bathroom, but they're in the middle of a lesson and they can't get up and go, that they'll find that the more often that their teachers tell them they can't go to the bathroom, the worse they suffer with constipation. So if you don't respond to those urges, your body will just kind of say, why give them to him? He's not going to listen to me anyways. So, yeah.
So being aware of time. So I want to get us to the point where we can wrap up. So is there any more unusual thing? Is there something that you really wanted to talk about that is not in the common spectrum that we talked about that just people should know, or anything that really stuck out to you today?
I think maybe the big thing I would like people to know is that, if something feels abnormal and it's not comfortable or it doesn't feel, right to you, it's not your normal, then go see someone. I find that a lot of patients, especially women, will say, well, I'm not dying of cancer, or, I'm still able to go about my daily life, which means that this isn't a big priority or big issue enough to go see a doctor. But I'd combat that and say that you are allowed and you should want to, and you should be able to feel your best and live your best life. So if it's concerning to you, there are ways that you can get assessed outside of a colonoscopy, or, even if you've been to a conventional gastroenterologist, a lot of the times they're looking for really bad stuff, like cholera. Like cholera will put you in the hospital. And I'm not checking for that because you're obviously going to be sitting in front of me in my clinical office. And so there are things that I call them, functional disorders. So there are things that could be wrong, but they wouldn't necessarily put you in the hospital. You're kind of in this little gray middle ground. And that's where we thrive. I mean, that's where both of us practice. That's where both of us really do good work. And so just reach out for help to someone. So,
well, which of course brings it into talking about it, because a lot of people, so every time somebody brings something about constipation or menstrual cycle or any of those, they always precede it with, this might be too much information.
Yeah.
I'm your doctor. I mean, that's part of what I want you to tell me about. Like, I don't want you to wait until something has got you in the hospital. I want you to talk to them. Like chiropractic, and as I guess a lot of your practices too, it is as much about being proactive and preventative as it is about being reactive at all. I'd much rather people come in symptom-free and tell me about little things that are different in their pattern, so that we can preempt any of these things so they don't have to grow into big dysfunctions.
Yeah.
So I guess that's one of the things that kind of triggered in my brain is I hate when people say, this might be too much information, but no, just come on.
Agreed.
Nobody can help you make sense of it.
If you can't tell your doctor these things, then who can you tell? I mean, that's your job. And so I would also say, I've probably heard worse. So whatever is going to come out of your mouth, I'm sure that I've heard worse. So no need to be shameful. There's no judgment. Just get it all out on the table. And then if we know all the information, we know the details, then that's how we can figure out where to go from here.
Well, and that's how we deal with complex things too. I mean, if you haven't figured it out already, it's because it's not just a simple matter of doing one thing and changing one thing. It's you need help.
Yeah. So that's probably what I have to say. But,
I would say, kind of going back to the idea of prevention and being proactive, when it comes to digestion, we often think of elimination diets or going on a low FODMAP diet. And while these can be incredibly beneficial, sometimes that causes us to forget about very simple strategies that are also just as important. And that's really, when we take an approach, we really try to take as much of a holistic approach and talk about food, but also not just talk about what we're eating, but how we're eating it and when we're eating it and where we're eating it too.
Right.
So if we're eating in a very stressed, distracted environment, we're rushing and we're not being connected to our food, that also can provide just as much difficulty on our digestive system to break that down adequately, because there is so much connection when we talk about the vagus nerve and the gut-brain connection that relies on being present in the moment when we're eating. And so while we're talking about maybe following an elimination diet or following a specific dietary pattern, we're also talking about, while you do that, I don't want you eating in your car. Like, let's talk about ways that this can be successful for you, that allows you to be a little bit more mindful and present in the moment and slowing down, chewing food thoroughly.
That's actually a really interesting topic that I had forgotten, that I hadn't even associated with this conversation, but it's very relevant because we're only really now, as a scientific community, starting to understand how important your mood is to all of your bodily functions. Because, all of these mood things that it's easy to say are so ethereal, oh, it's just a bad mood or something like that. They really, they have chemical and physical effects on your body. And when you're talking about eating while you're stressed, your body is not designed to digest food while you're stressed. So that's automatically going to lead to issues with all of those. It's also not designed to do, that leads to all kinds of things. Fertility is another one that comes up a lot with people who are super, super stressed. If your body's not capable of carrying on a pregnancy or of raising a child, you're not going to be capable of getting pregnant. So so it's very interesting. And I'm glad that you brought that up, because I had not thought to bring that into this conversation. But being aware of what you're doing and relaxing enough to actually digest a meal.
Yeah.
So are there specific things other than just being mindful and stopping that you recommend for that part?
Part of it, I think, is even being mindful about the emotions that you're coming into a meal at. So there was a really interesting research study that was done where they took individuals and they ate a meal kind of in a very peaceful, calming environment. And then they replicated that with the same individuals, but they had a 24-hour news cycle going where it was a lot of very negative, stressful news stories. And then they rated their digestive kind of symptoms and also their stool and their bowel movements. And there was significant malabsorption and digestive complaints in the same individuals, but when they were eating within a very stressful environment. And so really, I think that, again, goes back to this idea of checking your emotions and then seeing, okay, what can I do to reduce stress before I start eating? So it might be just taking some simple deep breaths to really stimulate the vagus nerve, prepare the body for digestion, minimizing distractions, and then chewing your food very thoroughly. And I think a lot of that, if we can make time to sit and eat with other people, it's so much easier to do that, because we're going to be more present. We're going to slow down because we're having a conversation with someone else while we're eating too.
Yeah, that's incredibly interesting. So yeah, it seems like we should probably wrap up for the sake of letting you guys go about your day. Any final thoughts that you wanted to toss in there? I know I said that 10 minutes ago, but we had some really awesome final thoughts.
I think those are my final thoughts.
Great. Well then, thank you guys for joining me for this. I'll let you go. Did you want to leave any way for people to get in touch with you?
Yeah, so Katherine and I are both really active on our Instagram profile. So that's where we kind of use as our little soapbox to deliver and dispense information. And our handle is at MPLS, so Minneapolis, MPLS Integrative MC. And so you can find us there, which will branch you out to our website, our email, all the ways to get our blog posts, all the ways to get in touch with us. And yeah, we just love to be a resource and a source of information for people. And if you, or, if anyone that needs more personalized care, then we would love to help them in person.
Cool.
Yeah.
Well, thank you guys for joining me. I'll let you go. Have a
Thank
great day.
you. See ya.
Bye.